We know a lot of you do have questions about these latest requirements and information here in our area, so we want to get you some answers. Physician and ABC News Chief Medical Correspondent Dr. Jennifer Ashton joins us now. Thanks for being here.
Thanks for having me.
You know, we've been hearing a lot about the COVID numbers. This really, it sounds like in our area, is a staffing issue. Our own health department talking about they have plenty of beds and equipment, just not enough staff. So what do you make of all of this?
Well, first of all, I think it's a cautionary reminder that it's not just the risk of COVID-19 that puts all of us in jeopardy. It's important to remember that the everyday heart attacks, strokes, car accidents, those things have not stopped just because we're in the middle of a surge or a pandemic. And when you hear statistics like the one you just mentioned about there being 2 ICU beds available right now and not enough staff to take care of critically ill people, we need to be clear that puts all of us at risk because those things still continue to happen and it jeopardizes our overall healthcare system. But in terms of beds and staff and supplies and systems, those things all need to be ready to go into high action. And right now they're not. And your words really remind us of that.
Let's talk about young people across this country. The last report by the CDC showed that there were 349 children who died from COVID. Obviously, any death is too many. But when you look at how few children end up in the hospital throughout this pandemic, in our own area, I think they showed 66 children ending up in the hospital. So why are we pushing children to get a potentially emergency use authorization vaccine when we see these numbers in kids? They don't show the same types of symptoms as maybe some of our older adults.
It's a great question, and I think it's really important to understand, first of all, when you talk about the pediatric age group, this is a unique and potentially vulnerable population, and there's a saying in medicine, there are worse things than death. So it's not just the number of fatalities, which I want to be clear, one child lost to COVID is one too many if you're talking about that child's family. Yes, in general, they are at lower risk for serious illness and death. That is before the Delta variant, and we have heard in the last 12 to 24 hours the American Academy of Pediatrics imploring the FDA to authorize for emergency use vaccines in the age group of 5 through 11 years of age using the existing safety data that is already there, that already has been collected, and continuing to monitor for safety and efficacy as they do the clinical trials, because we are seeing over 90,000 cases in the pediatric age group in this country, largely attributable to the Delta variant. And it's not just the risk of death. Long COVID symptoms in the pediatric population is a risk. Hospitalization, ICU care. We can't just turn a blind eye to that and say, well, it's a low risk, so therefore we don't need to act on it. There's a saying that I use all the time as a doctor, as a mother, it only has to happen once. And if the worst case scenario happens to you or your child, have you done everything possible to avoid that outcome? And right now, that includes an effort with safety and efficacy data to authorize vaccines for children under the age of 12.